Welcome. Okay. Okay, well, maybe what I'll do is maybe I'll begin with Nonkululeko's introduction, maybe, and we might have a few more people join as we go. We've got a great start here. I'm going to just read her bio so I don't mess it up. Nonkululeko is a certified bereavement doula and perinatal loss advocate, as well as the founder of Umzanyaya, I hope I said that right, a nonprofit inspired by her own personal experience, the stillbirth of her baby girl in 2010. She's become a leading voice in her community and beyond. She is a published author, contributed to many articles and blogs and magazines. Her commitment extends beyond her writing as she actively supports families in her community through the journey of perinatal loss. She conducts support groups and workshops with clinicians focusing on empathy and compassion. And she and her team donate resources to disadvantaged families who've had a stillbirth, providing emotional support and material support. So she plays a crucial role in education and resource sharing, reaching out to professionals in need of information. Through these efforts, she's committed to fostering a world where the stigma surrounding perinatal loss is replaced with empathy and understanding, and ultimately striving toward the prevention of stillbirth. And I do love the topic that Nonkululeko is going to speak to. Many of us are very aware of the stigma, and it's always difficult to think about the loss of a baby for a woman, but then to have to also deal with the stigma and the treatment that she receives afterwards just is kind of overwhelming to me. So I love this topic, Nonkululeko. I know that this is common in many parts of Africa. I don't know about other parts of the world. That would be interesting to know. And maybe we can hear from people when you're through. But I think a really important topic for a lot of women who experience stillbirth. So everyone, welcome. And I'll turn it over to you, Nonkululeko, and you can share. Let me make sure I've got this ready for you to, yeah, you should be able to share your screen, and because it's not come from me. And we will make sure and have time at the end for a discussion. We love the discussion that happens during this ISA Presents. So we will make sure and save time for that. So I will say, take it away, Nonkululeko.
Greetings, everyone. Thank you so much, Sue, for the very kind introduction. Can you see my screen?
Yes, we can.
Okay, thank you. So my choice of topic was, I was actually challenging myself because it's not something that's spoken about a lot here in our African continent. It is discussed privately, in quiet spaces, but not in open spaces where we can actually freely have a discussion. So thank you so much for allowing me the platform. So stillbirth, taboos, and stigma in Africa, that was my choice of topic. I will start with understanding the impacts and finding solutions, because most of us that are here, I believe that we already know what a stillbirth is. But then maybe we don't talk about the impacts and the taboos that come with this event. So understanding the impacts and finding solutions, that is my main ultimate goal, and I hope that each and every one of us at the end of this presentation will be able to share.
Excuse me, Nonkululeko. Excuse me, everyone. Could you please mute yourself? We can hear a lot of talking going on. So can you please mute so that we can just be listening to Nonkululeko? Thank you.
Thank you. So taboos and stigma become with cultural silence and avoidance. So this basically means that there's a reluctance to discuss stillbirth openly. We're not sure if we should talk about it. I have personally experienced this, and throughout this presentation, I have to say that I will be sharing a part of my experience as well as I go along. Not only my experience, but I'm sure that many of us parents out there have experienced these type of taboos and stigmas as well, such as cultural silence and avoidance. So you're not sure if we should discuss stillbirth openly, especially when we seek support from our primary people, like our family or people that we reach out to when we are in a state of needing support. Fear of bringing bad luck and shame to the family is also part of the reason why we don't really want to avoid talking about it, because there's this belief that having a stillborn baby is bad luck. So if you bring the baby home, then you're actually bringing bad luck to the family. Some families in our African cultures interpret having a stillborn baby as such. And then lack of public discourse and awareness as well. Believes that stillbirth is a result of curse and bad luck, social ostracism of mothers who experience stillbirth. So socially, they will also not be welcome. And there's a question that always comes from the people in our community, uh, especially when you come home from the hospital and maybe, or you've just given birth and maybe your tummy looks a bit flat. Then they'll be, okay, so did you have a baby boy or girl? And you know then you have to finding yourself explaining the event over and over again. Some may not understand and some may blame you or the life that you're living, or maybe even blame the marriage that you're in. um, there's isolation and exclusion from social and family activities as well, because some of us, it might have been our first child, and so maybe there's a family activity. And in our cultural settings, especially in the Zulu culture, when there is a gathering or when there is a ceremony, mothers will sit in one place, and then the maidens will sit in the other place, and then fathers will have their own space. So you will find yourself questioning if are you a mom? Are you not a mom just because your baby is not here? Then where do you sit, or where do you go? You know, who do you gather with because you feel isolated? Uh, and then there's an impact on women's social standing as well as marital prospects as well. So just because your baby is not here, does this mean now are you a woman, a full woman? Are you a wife? Are you really a mom? Should we even call you um, someone's mom just because your baby is not here? So in most of our African families as well, if you are a mom, you are addressed. I know it happens in other cultures as well. I have heard they will address you as someone's mom, Dando's mom. So if Dando, my baby Dando, is not here with us on this earth, does this mean now I'm not Dando's mom? And then lack of discourse. Okay, so I've already addressed that. So the impact on families. Impact on families would be emotional burden and prolonged grief. This is actually caused by um, not being sure, or the family not actually grieving, or giving you the space to grieve the way that you would want to. So they will be prolonged grief, and then there will be misunderstandings. You're not allowed to talk about your baby. You can't, okay, so even if you choose to have a funeral for your child, but then um, after the funeral, then what happens is at the end of your baby's celebration, will they be ever be maybe a birthday celebration, or maybe a church event, or a ceremony culturally, or is that the last day that your baby is actually spoken about? And breakdown of marital relationships due to blame and stress. There is strain on family dynamics and support as well. So the in-laws, extended families, they also want to have an opinion. Some may go as far as taking the matter into their own hands, because they would want to see a cultural diviner or a priest who can actually clarify what happened and what caused this thing, because the doctor's explanation is never enough in our African family, in most of our African families, if I may put it that way. So they would more like a spiritual intervention. And maybe the parents actually don't want that. Maybe they just want to heal and rest and continue with their lives, but then the family will intervene. And then there's siblings confusion and emotional impact. So with my I just want to share, when last year I took my babies to the siblings grave for the first time, because I realized that they're actually grown enough to hear about this and not hear about this from someone else in the family. So I should be the one breaking the news to them that, hey, 13 years ago, you had a sister, and your sister was stillborn. Unfortunately, she left us, but this is where she is. So I showed them. And then the questions that came after were actually questions that I were not expecting. So they would sometimes they still randomly ask me, so mom, where is she? Is she okay? Do you miss her? When is her birthday? Maybe we should do something. So siblings as well, they're also affected just as much. And emotionally, they might not take it well. And emotionally, you might find that actually having them know would also strengthen or encourage your healing as well. Economic impacts due to funeral costs and medical expenses. That's part of the reason why the grief is sometimes prolonged, as well as impacts of religious teachings on community attitudes. So just because someone believes in this, or someone falls under this religion, then they would judge and say, oh, it's because you're not part of our group, or maybe you should be part of our group, because so that you don't experience this again, you know. So there are those type of comments that happens as well. And then there is isolation and effect on affected families from community events, um, community and social impact. So impact on social status and community participation. I think that also falls under, that's similar to what the family you might experience with the family, but in a wider audience or in a community, because there's even a belief that goes as far as maybe you did something with this baby, a ritual. So there are ritual beliefs, and they actually might blame you, not only blame you, but actually believe that you took the baby and you did something with it, and that is why you no longer have a baby. Society also plays a role. There is potential for support networks within the community to provide assistance. There's none actually. There's not much. And if there are people who are knowledgeable, they're not given space to support families in a proper manner. And so there's the role of community leaders in perpetuating or challenging the stigma, um, especially when we seek help from them. We find that they're actually not educated as much when it comes to perinatal loss or stillbirth. They don't have much information to share. So they might share from a space of being judgmental and not supportive. Influence of religion and cultural beliefs. So religious interpretations of stillbirth such as divine punishment. So God is punishing you, you're not a good person, or you did something years ago, so now God is punishing you, or the ancestors are punishing you. So now you need to carry out a ritual. And that also adds to the burden and it prolongs the grief as well. Cultural rituals and practices surrounding loss, including cleansing and ritual. I was once told that there's a dark cloud or a baby is a dark cloud. So, and then I asked this person, so it was an elder actually. So if you say someone that I have loved for 9 months and someone that I actually had dreams and hopes about that I could see myself spending my life with is a dark cloud, what happens to the love that I have felt for this angel? Someone who's never walked this earth, how can they be bad luck or a dark cloud? So now I need to be cleansed of this person's energy and removed. How? I'd understand that maybe if it's a curse that needs to be closed or whatever, but at the same time, how can they be a curse or something bad when they actually made me feel good and feel better about myself, see myself as a mom? So those were the questions that I actually asked, and they were not answered by these elders. Role of traditional healers and spiritual leaders in providing explanations and solutions. So traditional healers, they also play a huge part because, like I said, spiritually, when we seek according to our cultural beliefs or religious beliefs. So we actually look for answers beyond what the midwife would say, beyond the diagnosis. We want to know more. And once we know more, we become at peace. We know we find peace and clarity, knowing that okay, maybe this is why this happens, and this is why maybe um I should heal or I should start my healing journey. But they're not actually doing what they're supposed to be doing. And they're not educated, they're not informed about these things, how to share, and how sometimes it's okay to say you do not know. But they don't know that it's okay to say you don't know, or just to comfort someone when they come to you for answers, because you may not have all the answers, but you may have a shoulder to cry on or a hand to hold at that moment. That's all that's needed. And impact on religious teachings on community attitude as well. It also plays a role. And a few weeks ago, there was a workshop that was held where traditional birth attendants were in a workshop with clinicians. And it was such an interesting topic to be held and to hear them speak about solutions and working together, the Western way and then the traditional way, for the sake of the community, because whether we like it or not, they're still gonna need to work together. They are needed by the people. But what I didn't like is the topic of loss was not discussed. Um, there's still that silence around um, perinatal loss or stillbirth when it comes to these discussions, of which is something I'm working on almost every day. Solutions and approaches. So education and awareness campaigns need to be applied in our communities. If we can get a group of traditional birth attendants and clinicians in one room, I'm sure that there can be more discussions that can be held in all spaces, in every spaces, every opportunity that we are given, especially people who advocate for stillbirth. We bring it up, we find a way, we find a platform, we make sure that these conversations are held for the sake of the parents, and not only the parents, our grandkids, our great grandkids. I understand that it'll take us years to undo this um, learning. We're not undoing, but basically we are blending. I call it blending and balancing, because some of these beliefs, they might not be healthy. So we need to find a healthy way of doing things and try and remove their unhealthy way of doing things. Support groups and counseling as well. So then these also need to involve or include a space where we can actually be ourselves and speak about openly about our our losses or stillbirths without being judged. Collaboration with religious community leaders. These are the people that we look up to in the community. These are the people that we seek support, or we seek their guidance and they assistance, sometimes even financially, because if you don't have the financial means to bury your child or your baby, then these are the people that we go to. And then when we have to explain ourselves to them, and then we get judgments, and we end up not knowing who to run to. And promoting open dialogues and sharing experiences that should be done effortlessly. We do not have to fight for platforms in our African community. Policy and healthcare improvement as well. I'm happy that our clinicians are getting along. We've had sensitive midwifery symposium where I was presenting a topic on stillbirth and explaining the role of healthcare providers in the event of stillbirth. And it was received with such positive attitude. And I'm hoping that we will get more people to have presentations and keynotes around stillbirth. And then advocacy for better healthcare services and support for bereaved families. Our African clinicians and healthcare providers, they need a lot of training. There's conversations going along. And I'm happy that in our SOG subgroup, this is part of our discussion. I hope that it grows and we actually execute all of these plans that we have so that we can have a better outcomes. Implementations of policies to protect the rights and dignity of affected families. This also needs to apply. And I just want to say that beyond, there is we call Ubuntu.
Excuse me. Birth, can you mute, please? We can hear you talking. Birth, are you there? Can you mute, please? Thank you.
Thank you. So in closing, I just want to say that we speak a lot about Ubuntu in South Africa and in Africa as a whole. We even implement it in our curriculums, in schools, in education, in our churches, in our groups. And I've seen that even in our clinics and hospitals, there are Batupili principles. So Batupili is a Sesotho meaning people first. So people first before everything else, before religion, before culture, before the judgments and stigma. We put our people first and we put each other first, and that will help us facilitate and help us heal throughout the process in an openly and a healthy manner, without being without closing off the grief and putting it away in a box like I did years ago. And I decided to open the box years later, and unpacking the box has been a roller coaster ride. And I hope that as we learn and as we have these discussions, we actually find solutions for our continent as well. Thank you.
Thank you, Nonkululeko, very much. That was a lovely presentation. Maybe I will ask you to stop sharing your screen so we can see everyone a little better. And then if people would turn on their video, I think that might be nice as we share a little bit here and ask questions of each other. Are you able to turn on your, yeah, there we go. We've got Nonkululeko as well. So yeah, this is just a time for you all to share your thoughts in what Nonkululeko has shared with us, to ask questions. We really love the interaction that we have during this time. And we have people from other continents than Africa, so that would be interesting as well. So I will just open it up. I don't, I can call on you if you want to raise your hand. Otherwise, I'm open to you just sharing, turning on your mic and sharing. Okay, I see something in the chat from Tomkin. Thanks for sharing. Similar in India, she says. Anything you'd like to share with us, Tomkin, on that it's similar in India? Any of your thoughts related to your experience in India?
Hi, everybody. I just had to attend another meeting, so I just sent my comment there. Many of these, the problems that stillborn mothers face in Africa, it is just like India. Not, not, first of all, not revealing to the mother what happened, why it happened, not handing over the baby to the mother, not even telling her that it was a stillborn baby, and then quickly disposing of the baby, not taking the mother. And one of the reasons why they don't take the baby home is that they think that it is something related to luck, or luck, or some, what to say, how to put it, beliefs like there's somebody did something, some magic or witchcraft.
Mm-hmm. A
So
curse?
that is
Like
one of the
curse?
reasons. Yeah.
Mm-hmm.
Yeah, like a curse. Yes, magic and witchcraft. That is very much common, and usually they attribute it to somebody in the family, another woman who's childless, maybe. So many times they attribute to another family member who is childless, and they think that because that woman doesn't want another baby in the family, so she has, resorted to all this witchcraft, and
Yeah.
and that's why the baby, this mother lost the baby.
Interesting. Interesting. Thank you. Other comments from your experience?
Hello. Yeah, could you hear me in the last part?
Yes. Yeah, we did hear you. Yes, thank you. Okay, thanks, Marty. Have others of you experienced anything similar in your practices in your area? I know there are some similarities in Uganda, and I know we have someone from Kenya on. And Linda, I'm sure you have experienced some things. Can any of you share what you've experienced related to this in your areas?
Maybe just briefly because I'm in a meeting now, so I cannot talk
Okay, it
about.
looks like we're hearing. Can I hear from Oshai?
Yes,
Is
because this
that
Linda.
right?
Yeah, that's Oshaji from NYPOs
This is
from
okay.
Nigeria.
Okay.
Hello, everyone.
Hello. And where are you from? I'm sorry I missed that. Oshalihi.
Oshaji from Nigeria.
Nigeria. Okay, please
Yeah.
share with us.
Right. So in NY polls, we do a lot of opinion polls and we speak to women of childbearing age to get their experience for pregnancy right from ANC all the way to delivery and even after delivery. So we do that in 10 states in Nigeria. And whenever we do these polls, we get to talk to a lot of women who have experienced stillbirths during their period. That was the outcome of their pregnancy was stillbirth, and we find out that most of the time when we get with those mothers, they are very suspicious of how we got their numbers. Why are we calling them on this? It's something they've tried to forget. Why are we reminding them? And we are just trying to get some information generally, and we don't really particularly target mothers with stillbirths. But we do this polling twice every year, and the experience for stillbirth has been maybe like out of 5,000 women we speak with, probably about 10 to 20 of them had that outcome. And it will be interesting for us probably after now, and I want to particularly propose that probably after now we will do a particular survey just targeting women with stillbirth experiences to get some deeper feedback from them on how the experience was. So I just felt to share that it's part of what we do here, and it's very interesting to be a part of this conversation and learn how mothers cope with this particular experience. Thank you very much.
Thank you. Thank you. Excellent information there. I'm sorry, Linda, you were going to share. I'm sorry. Can you share now? Maybe not. Okay. Other experiences, that's great. And again, after a presentation like this, I think we just have more data and more information. Oh, there's
Hi,
Linda.
Sue.
Okay. Hello, Linda. Please
Yes,
share.
I'm in a meeting, so I couldn't.
Oh.
Yes, I was just going to say that I did a bit of work looking at what happens with people who have stillbirths. And one of the things is that they are not allowed to even see the baby. And I think that is part of the stigma. They are not allowed to be part of the burial of the babies. Some of them are not even allowed to hold the babies. So there's a lot of that. And then you're also not allowed to cry for more than 2 weeks. And so many other things. At one particular place, they said they give you a doll made from wood. So a wooden doll for you to hold. I think just so that you console yourself, kind of. But there are a few things, and I know that for some people, it also ends in separation or divorce or being called names, just as Nonku said. So we have some similarities with what happens in other parts, including Ghana.
Yeah.
Over.
Thank you. Thank you. Yes, Denise. Denise, please share with us. You're muted.
Sorry, I was muted. I want to thank the presenter. I didn't get her name.
Nonkululeko is her name.
Yeah. So I keep telling people Africa is one country. I know they say that, but it's like copy and paste.
Yeah. Oh, you're muted again.
taboo myths. It's like it came from Adam and Eve, like Adam and Eve were in Africa and they just spread it and it went around. So especially around an infant loss, it's like repeatedly hearing the same thing. You can't talk about your baby. You can't, you're not supposed to acknowledge that you lost a baby. You can't bury your baby. You can't, it's like they're trying to erase the memory of your child. And that whole, are you a mother? Are you not? So here we would say, let's say mama, they'll call you mama, so the name of your firstborn. But if your firstborn died, you are in limbo. You're not a mama anything, and yet you carry the child. You gave birth. You know, so it's definitely a conversation we have to continue advocating for. But it's so ingrained in culture and religion that even the midwives, the medical practitioners, do that. They don't have a medical, their advice is not based on medical, they go back to culturally we don't do this. Maybe you jumped some witchcraft somewhere, maybe you did, and you're like, this is not medicine. I'm in a hospital, you should be giving me information, medical.
Excuse me a minute. Dr. Adolphe, could you mute yourself until we get to you? We can hear you talking. Dr. Adolphe, could you mute yourself? Thank you. Okay, thank you. Sorry, could you mute yourself and then we'll get to you? Sorry, 1 minute. Thank you. Sorry, Denise, continue. Oh,
Yeah, so
there you are.
So there is not that much evidence scientifically because we're also not allowed to talk about it. So this raising awareness and having the support groups and educating and having the symposiums and the workshops is very crucial to breaking that stigma. But also the mothers themselves have to feel, or the parents, the bereaved parents, have to feel that this is normal. So that's now the challenge that we have generally as a community, is how to normalize. So even the medics, I like that she mentioned they had a sensitization or something for the midwives. It's quite important to have these key people, the first points of contact, to know the language to speak, the words not to say, and also to be empathetic, because that's literally what's missing. And in Africa, we just have that attitude. Because when she was talking, I was just like, oh my God, this is like here. It's like she's talking about us. We just have that attitude of, you know what, you're not the first one and you won't be the last, and yet this is happening to you fresh. So I want to thank her for her presentation.
Yeah, wonderful. Thank you, Denise. Well, Fenny wanted to talk, but we've lost her. But Dr. Adolphe, did you want to? Oh, she's coming back. There she is. Okay, well, Fenny and then Dr. Adolphe. Fenny, please share with us.
Hi. Thank you so much, Nonkululeko. I hope I'm pronouncing your name. Your story. This is, I think when it comes to the entire stillbirth world, there are people who are focused on prevention and those, and I'm one of the bereavement care person who's really focused on how we care for bereaved parents. I think for me, so I'm from Liberia. I live in Liberia, but what really sparked my interest was when I went to school. But then also when I got back, I started to talk to people, and there was a guy who was telling me that his wife had a stillbirth, and till now they don't know where they buried the baby. They weren't allowed to be there, so they have no idea on where their child is. And he's like, at least for her, she had some form of comfort. But for him, no one even stood one day and was like, oh, he too, he had lost a child. And so I think for me, that's why because I'm trying to do my PhD on this particular topic, or DRPH, one of them, whichever one I get to do at the end. But that's why I think it's so important that it has to be inclusive. Like men, I think speaking to him, it was the very first time I was like, oh my God. Because when I thought about it, my PhD was going to focus on, it's going to be like bereaved mothers. And so after I had the conversation with him, I changed it to bereaved parents. And, he was just saying their family was supportive. It was just people within the community and people at work that weren't supportive because they were not knowledgeable about it. Like it's such a hush-hush thing. No one says anything about it. And at the facility, they were like, oh, yeah, don't worry. You will have another baby. You'll try again. You'll have, don't worry. That one, wasn't meant to be. God did not want it and stuff like that. And how it even affected his relationship with God because he was like, how can you say God did not, you know what I mean? I thank you so much for sharing this story. If anything, it really has highlighted the importance for bereaved care while we're doing while we are to prevent and really working on prevention. I think really ensure that the parents who are going through it now, who are bereaved, that we're caring for them and giving them the very best support. So thank you very, very much for sharing your story, and I'm sorry for your loss.
Okay, wonderful. Thank you, Fenny. I'm going to move to Dr. Adolphe if he would like to share, and then we'll go to Heloisia. Dr. Adolphe, did you have something to share with us?
Yes.
Hello.
Okay. Hello. Yeah.
Hello.
I'm sorry I came late. I was driving from a remote area. Just I had to connect, but unfortunately it was not easy to me to connect. And just I'm arriving now, but I'm happy to meet you and hearing from what you was been discussing, and just few comment about what she has been saying about taboo. So when I just share a little experience from Rwanda, where I'm coming from. Yeah. Just for case of stillbirth, on some cases that we have been interviewing, there were some cases who had like repeated stillbirth, like 2 times. Especially the case who had preeclampsia, and she had a recurrent preeclampsia and stillbirth again. But to her, they were thinking that it's like taboo. It's like she's a patient who can't anymore have any live baby, and we believe some witchcraft, like traditional. Yeah, so those are like things which some of the patients were experiencing, and maybe say, oh, this is it's like I'm condemned to not have any live baby. So those are like patients who need really psychological support and close follow-up, and to be with the parents, especially once they can't feel like it's a taboo for them to have a stillbirth. So they can share the experience as well. And as we are working on that, maybe we need to have this kind of a stillbirth working group with patients who had stillbirth in Rwanda. Yeah. So it's really something we are now going to try, but maybe we'll be okay with that. Thank you.
Yeah, thank you. That's exciting. Wonderful. Thank you. This is great. We're going to get to Heloisa now, and then I want to make sure to touch on SOG. Some of you are in SOG as well, and I want to talk to you about how the bereavement perspective that we're talking about here today, we want to be incorporating more into SOG. So I want to save some time at the end to just pick your brains a little bit about how we can make sure and focus on that in SOG, because SOG is not just advocacy, although bereavement care is advocacy for mothers, right? It all kind of goes together. But I think we look at things separately, advocacy, prevention, and bereavement care. And we want to make sure and include all of those in SOG. So, but Heloisa, please share with us.
Hi, hello, everybody. I'm Heloisa from Brazil. And first I want to thank Nonkululeko for sharing your story. And while I was hearing, I was thinking about our Brazilian reality, and I found out that we have very, very similar aspects around grief and bereavement for losing babies and pregnancy. Here, I don't know if I can say that here these aspects are related to religion matters, but I think it's more for cultural, because we deal in a very bad way with death, grief. So here we think that it's better to go through and to return to work, and we used to say pull the page from the book. So let's go on and let's return to our life. And then we don't have this time to grieve for our dead beloveds. And here we think that losing babies and pregnancy is a not recognized grief. So we still hear those things you all said about, you still hear in your culture or in your country, as you are very young, you can have another baby, think that it's better that he died now than after, and so on. And here there are a lot of people, healthcare providers, that don't let families see the baby, carry the baby, stay with baby, and everything very similar. And it impressed me because we are so distant geographically, but we have these very, very common things and aspects due to this type of grief. But I want to ask you all something that people are asking me here, because they heard from me when I went to UK that people can take the baby home, and can stay with the dead baby home for until 72 hours. And here people think that it's so morbid to have your baby with you to carry your baby inside the maternity ward while this baby was just born. So they think that it's a very, very morbid thing, and I don't know the correct word in English, but something you even can think about, to take a dead baby home. And I wanted to know how in this different culture you think about this possibility, because I think that this is something I want to start talking with people here in Brazil and in Latin America, because as long as I know, we don't have this 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 thing to pass with our family and our babies. Thank you, and sorry.
No, wonderful. Thank you so much. Before we get to Abera, does anyone want to respond to Eloisa? Nonkululeko?
I think this goes back to what the discussion that we had about sensitivity and empathy and compassion, because the humanness, if we first practice empathy and compassion outside of culture and religion, or maybe culture follows after empathy and compassion. We feel first before we even say anything. So to let them know how you feel, how you felt when the baby was inside you, how baby made you feel, how happy your baby made you feel. I don't think that anybody will deny you to hold your baby, knowing that the baby made you feel happy and excited and all these good feelings that you were feeling before your baby died. So it is introducing the not that you're changing or you're taking away the culture, or you removing, or you disrespecting culture, but introducing empathy and compassion, making them feel before you actually making them know that it's okay for you to hold your baby. It should be okay because this was once someone you loved and cared for. So maybe we can start there.
I think that's a wonderful idea. And I would just add again, Eloisa, that this has been the response everywhere around the world when this idea is presented. The key is to not get discouraged. And Nonkululeko has seen change. Denise and I have seen change in Uganda. I know that Linda's working hard in Ghana. So what I would say to you is do not get discouraged. It can happen. We've seen it happen. I believe it will happen. I think the other piece that I just want to throw in there is this is respectful care. This is not our decision as healthcare providers to make. It is our responsibility is to share what we know is going on around the world and to offer to parents what they want to do. So I think we always have to go back to that. This is the buzzword now everywhere in the world is respectful care for women. And what you're talking about doing is respectful care. Okay, sorry, Abera, we've got to finish up, but I want Abera to get in here. What would you like to add?
Thank you, Sue, and I also would like to thank Nonkululeko for the touching presentation. So I agree with the claim that Africa is almost one because we have so many in common. But I just want to raise 2 points that is affecting the way that we are doing about the stillbirth. So the first one is the missed opportunity that we are having because we are not talking about it, so we are not learning from what happened, especially in cases of repeated stillbirths. If we are not doing audit, if we are not learning from it, we will not know, especially when it happens as a result of races and other diseases which are rarely screened for women. So that's one of the point. And the other one is the healthcare providers fail to support. And of course, that's because of lack of specific trainings on breaking bad news, on brave care and counseling. But I feel like we are failing in letting the parents brave and have their issues discussed. And but the question is, what can we do? I mean, as you said, there are changes from few ongoing projects in Uganda or in Kenya, but also even in Australia, when you see all the things that are going, there are still a long way to go and a lot of lessons that we need to take. And I agree with working with SAUG so that we can share experience and learn from each other. And that's why we are trying to have a community support group who can also connect the healthcare providers who are not trained, but at the same time help women so that they can know what's happened and what they can do in the future so that it won't happen again. And yeah, thank you. See you as well.
Wonderful. Excellent, Abera. Excellent. Yeah, I agree. It does feel like it will take a while. But again, I think you need a few key people. I know Fenny is still on the call and I've talked with her. You need a few key people, a few physicians, a few midwives who get this, who understand this, and who are willing to try it and offer it. And then it will grow because your mothers and fathers will appreciate it. And then it will grow and then it will change. And it may not be forever. It may just be a number of years before you can see the change. So do not give up. I want to give Nonkululeko the last word here. obviously a great ISA presentation needed. Thank you for all your dialogue. And as I said, we want you to continue to join SOG each month. We're going to try to have a space each month where we address the bereavement care. And I've heard that from you today, that that's something you really want. So please try to join those SOG calls as well. And I will take that back to SOG. But Nonkululeko, would you like the closing words here?
Thank you. I just want to say thank you and thank everyone who took their time and came and listened to my presentation with such kindness, open-mindedness, humility. I'm excited to see what we do together, what we continue to doing together. And yeah, I'm excited to see us grow. And have these conversations even beyond these presentations as well. Continue to speak in our platforms that we're in, our WhatsApp groups, our emails, and connect so that we can have what can we do question answered, ongoing, and encourage each other as well. Thank you so much, everyone.
Thank you. And I want to put in a plug for Linda Vanuatu and her African group. I know, Eloisa, you're not in Africa, but many of you are in Africa. Linda is leading a group really focused on Africa. And boy, if all of you would participate in that group with her, I could really see some change take place. So I really want to challenge you. Linda, in our last minutes here, do you want to say anything about the African group? I know you're in another meeting, but please email Linda. And maybe if you don't have her email anybody in ISA. Just email the ISA thing. I get that. I'm the secretary. If you want to get involved with Linda's Africa group, please do. It would just be a wonderful group of you. I can feel the energy here in this meeting. Linda, are you available to say something now or not? I guess not. So that's okay. But reach out to us if you would like more information about her group. Thank you, Nonkululeko. Wonderful presentation. Thank you all. Wonderful discussion. And we will say goodbye. Okay?
Goodbye.
Goodbye. Thank you
Bye-bye.
all. Thank
Thank
you.
you.
Bye.
Thank you
Bye.
all.
Bye.